Okay. So
Okay.
this session is conducted by Invicta Academy, and it's part of our membership program, which is for doctors to enhance their business and marketing skills. And as mentioned, we would like to welcome Dr. Maria Khattar, who is a dermatologist and clinic owner, who's going to present tonight on the topic of patient loyalty in a competitive market. So, Maria, you should be able now to
Yes.
share your
Okay.
screen.
Share my screen. Yes. Just 1 minute. Where's the screen share?
I should be able to share it.
Yeah.
Okay.
Yes. That's it. Yes. This one? Yeah. Okay. That's it.
Great. So that's perfect.
Okay.
Okay, so now we can see your screen, we can see you, we can hear you. I will continue
Okay.
to admit participants as we go along. And
Okay.
in case anybody has any questions, you can drop them in the group chat below. I will be reading the questions out loud throughout the session, or ideally at the end of the session, we'll have a question and answer moment as well. Just a few people still joining us, so give me a couple of minutes and then we'll be ready to start. If it's your first session with us tonight, warm welcome and thank you for being part of this session with Invicta Academy. So Dr. Maria, it will be over to you when you're ready. Thank you so much for being with us tonight.
Thank you, Servan, and thank you for having me. The topic is creating patient loyalty in an aesthetic practice, because basically that is my experience. And please bear with me. I'm trying to move the slides. I cannot. Sorry, I'm just trying to, yeah. Okay. So bear with me while I go through my disclosures and backgrounds, because these are relevant to the topic. Basically, from 2002 to 2018, I founded and managed 4 clinics in Dubai. At the time, there wasn't much marketing. Actually, we didn't have any marketing, and we were able to feed the 4 clinics basically through patient loyalty and word of mouth. So that's how it all started. And as an offshoot of that, I established a trading company in aesthetic products and lasers, etc., consumables, injectables. From then, in 2011, you remember, Servan, I was asked to be the international director of the aesthetic fellowship of the American Academy of Anti-Aging Medicine, USA. And we established the Institute of Medical Aesthetics to house the A4M. So in 2018, my husband and I sold the whole organization. We wanted to retire. And a few years, 4 years later, 2022, out of boredom, I started again and founded Alta Derma Clinic and Training Academy, which now houses again the A4M USA. So, of course, in 2002, the climate was very different, with a plethora of clinics in Dubai. As you know now, we have almost 900 clinics. So the situation was very different. But strangely, when we opened, very soon, we found that a lot of my old loyal patients joined us in the new clinic. So the loyalty continued. Let's say for 4 years, I didn't have any activity at all in Dubai. And suddenly we find a lot of our patients coming and joining us at Alta Derma. So the situation in the aesthetic arena is very different. Patient loyalty is much more difficult to ascertain, because the patients are really not patients. Is it in an aesthetic practice, do we have patients or clients? To be honest, aesthetic patients do not need cosmetic procedures. They only desire them because they think that it's going to improve their quality of life. And if we think about it, a patient will take any advice from their clinician and they will not challenge the clinician. But the client is always more skeptical of the clinician's advice, especially nowadays with all that they see on Dr. Google and all the social media posts. they honestly, they feel that they can challenge you if they want to. So aesthetic patients are continuously evaluating your services, and the minute it doesn't meet their expectation, they will just switch to another clinic. So it's much more difficult to have patient loyalty. So gaining loyalty really centers upon delivering excellent patient experience. I think this is the most important thing, because this era that we're living in now, when we have the same products and services offered by a lot of competing clinics, the only way you can differentiate is how you treat your patient and giving them optimal service. So the experience that the patients have in your clinic will ultimately translate to the patient promoting you to their friends, to their family, telling people about you, and promoting word of mouth marketing. So loyalty is very important in word of mouth marketing, despite all the marketing tools that we have nowadays and the social media that we have nowadays. And if you see, this is from a quote from Wendy Lewis's book, Aesthetic Clinic Marketing in the Digital Age, where she says, word of mouth marketing is still the most effective way to market your clinic. So it all centers around on loyalty. Loyalty translates to word of mouth, and word of mouth feeds your clinic. So the positioning and branding is very, very important for the development of a successful aesthetic practice. So branding, you have to develop a brand rather than just a clinic. So everything should reflect your positioning, whether where you want to set up your practice, what is the decor, what is the ambiance in the practice, because it is an aesthetic practice after all. The selection of staff, the equipment and products that you offer, the marketing, internal and external, of course, is important, especially in this day and age. And so the framework of an efficient practice is really all of it, the marketing, the internal and external, the patient recruitment and conversion. So all of this is to get the patients to come to you. And then once you recruit the patient, how do you convert them into a loyal patient? And then how do you retain the patient? Because if you just are able to retain the patients that you have, you're halfway there. So you need to have a consistent message that will make a lasting impression so that you gain loyalty and you create something bigger than just a practice. You create a brand. Well, a successful practice really begins with effective leadership. Effective leadership means the clinic manager, the leader. The leader must be first and foremost an ethical person, a principled individual, especially nowadays, to be honest, where there is so much, let's say, lack of principles out there. So the patient soon figures out who is honest and who is not. So the leader must be a person that people respect and trust, and must have a solid plan and strategy in place, and constantly committed to develop their team. So the team is very important, and the team is what we have to really focus on. And so this way we can continuously develop and grow the practice. So the clinic team can be, well, consist of two things. Basically, the clinical staff, the manager, including the practitioners, the specialists, the aesthetic physicians, nurse practitioners, a head nurse, and many assistant nurses. And we have the non-clinical staff. The non-clinical staff, mainly the receptionists with a supervisor, accountants, cleaners, driver, valet, everybody. So what we also select as procedures is very important. All of the treatments offered must be evidence-based. There must be solid scientific evidence that the treatments that we offer are actually delivering what they promise to do. And we're not just selling promises in a bottle. We must use high-end approved equipment and products. And as a manager or a clinical manager, you must master all of the treatments that you have on offer. So you are the person as a manager to be able to train your staff and constantly update your staff. Because if you don't gain patient, you will not gain patient loyalty if your results are mediocre. So ensuring an excellent patient experience is really a team effort. It doesn't center around only one person. So you have to develop a bond with your patients, and this is necessary for long-term growth. And this is at all levels. Reception is very, very important. I cannot stress how important the reception is. Definitely, the physicians and practitioners have to be very competent in what they deliver, and the nurses. So it's a complete orchestra. It's a complete, team effort. And I never forget when we first opened this clinic in 2002, a patient walked in through the door who happened to be our old patient. And she came in, she told me, I've been homeless for 4 years. I've been going here and there. And actually, I've been frequenting this clinic for the last 2 years down the road. I won't mention the name of the clinic close to us. And she said, to be honest, it's 2 years I've been going to this clinic. Every time I go, they look at me at the reception and they say, and you are? They don't know who I am. They don't know anything about me. So what's the point? I mean, we haven't developed any bond. So this is super important. So we all, again, from Wendy Lewis's book, she says something very true, which she says, employ people that are nice and don't just act nice. And that is so true. They're not just putting on an act. They're truly nice. I mean, I know it's difficult often to suss out who's nice or not, but soon enough, you will be able to tell once you have them in your employ. So how can you ensure a good team effort? You need to understand that you have to understand the dynamics between the patient and the staff. Patients, when they walk in, they feel the energy in the place. I always say that. When they are lying down having a treatment, they feel the energy of the staff. So when the staff loves what they do, when they respect each other, they're in a much better position to make the patients feel happy and welcome. And all of this, the dynamics in the clinic, it depends upon the staff training. So staff training is of paramount importance. In terms of the non-clinical and clinical staff training, of course, these are different. With the clinical staff training, this is an ongoing venture. It starts with, of course, it should include generic training courses. If you can get your staff to go to a fellowship program, a certification, this is ideal because this is not commercially driven. Congress workshops, you should encourage your staff to enroll them in a lot of the congresses. And we do now have a lot of congresses within Dubai. So they have continuously workshops in these congresses. So it's good for them to go and attend. Industry-directed training, even though it has a commercial bias, is also of value. And you can then decide what makes sense and what doesn't make sense to you. And regular updating by the manager or the clinical manager, going through the standard operating procedures, updating them, getting feedback from the practitioners who've been practicing these procedures into the nuances of these procedures and how we can improve them and develop them. So ongoing training is integral also to the non-clinical staff, because admin should be also trained in terms of how appointments should be booked, how telephone communication should be done. You have to develop manuals, how they should answer and handle complaints. All of this should be done all the time. And non-clinical staff must be given continuous training to be able to know about the various procedures in the clinic. Even though they do not perform the procedures, they need to know what's being on offer. And they also need to experience the treatments that are on offer in the clinic. They need to know how it feels. So if anybody asks them, they can communicate their experience. And again, here, I don't forget when I first started my very first clinic in 2002, I took on a receptionist who was a very, very nice, like middle-aged lady. Her name was Nadia, I don't forget. And she was extremely efficient, but she had needle phobia. She would not avail of any of the treatments in the clinic. She was too afraid. And when people asked her, Nadia, what's it like to have Botox? She would say, oh my God, I can't have Botox. I'm so scared. It's very painful. Of course, that can't be. You cannot have anyone. So you must make sure that the people that are working with you are open to the treatments and solutions that you have to offer. So ongoing training, sorry, I've gone back again. So important to develop standard operating procedures, manuals for the nurses, for the admin, for the physicians. These manuals should be prepared by the clinic manager, validated. So we must make sure that the procedures are effective and make sure that the staff adhere to these procedures. And these standard operating procedures should be regularly revisited and updated. So this is very important because if you have anybody leaving your organization, say you have a physician leaving, then the patients can be directed to the next physician or the next the operator to be able to give the same standard of care. So it's very important. This ensures uniform protocols and you can have minimum variability of procedures. Of course, maybe the patient will feel more comfortable with one practitioner as compared to the other, but at least there will be consistency and minimal variability in the procedures, which will ultimately potentiate the uniform patient experience and hopefully increase patient loyalty to the practice. Then that's very important. You want patients to adhere to your practice. So the clinic manager will also be the one to award clinical privileges. So not every member of the clinical team will be allowed to perform each and every procedure. So these should be documented and regular audits in terms of the performance of the clinical staff. Now, the clinical procedures, as I mentioned, should be evidence-based, using only high-end equipment and products and updated. And then you have to master all of the treatments that you offer. What about patient interaction and communication? We know that communication is literally the foundation of all relationships. And even if you have something very important to say and you don't communicate it properly, it will not have an impact. So the manner in which we communicate is very important. And actually studies have shown us that the placebo effect has to do with communication. And these communication skills might not be inborn, but we can train people to develop the right communication skills. So effective communication is at all levels, from booking the appointment over the telephone, communicating with the patient over the telephone, the reception, the initial consultation, treatment by the clinical team, and proper follow-up. So essential communication is really, really important to build a successful aesthetic practice. So from the talking to the patient over the phone, the people talking over the phone must have, as we say, a smile in their voice. There must be positive and welcoming. That's the first contact. Then when the patient comes to the clinic, the initial impression is very important upon arrival, how they are met by the reception. So I always tell the reception staff that even if you say you have only one person at the reception, busy billing, talking on the phone, and somebody walks in, There is no excuse for not looking up and smiling at the person coming in and simply gesturing the person, telling them, please sit down, or I will be with you in a minute. That is enough. But you cannot ignore a person walking in. You have to welcome them in some way. Then after that comes the consultation, of course, with the medical practitioner. The consultation must be effective. It must be very honest and compassionate, okay? And then comes the quality of the treatment. Of course, if the treatment is not effective, all that you've done so far will fail. Then even once you do the treatment and the treatment has been effective, or you think it's been effective, follow up. How you follow up on your treatment, how you prove to the patient that their treatment has been successful. So the consultation and informed consent are an integral part of your overall practice. You have to be an attentive listener, communicate effectively, listen first, be humble, and don't assume that you know what the patient wants. Let the patient tell you what they want and address their concern. This will instill confidence in the patient. Have a non-judgmental attitude and be very diplomatic in your assessment of the patient. So I can't stress how important this is. I can't stress how important it is not to adopt scare tactics. Many practitioners in this field, unfortunately, will highlight the flaws in a patient. I think this is a very short-sighted attitude because everybody has a positive feature. So one has to look at the positive and slowly break in, depending on the dynamics between you and the patient. What you see needs correction. You might not want to divulge everything that needs correction at the outset. Maybe step by step, address their concern initially, gain their trust, and slowly try to bring in what you think needs to be improved. So watch out, very important, for signs of body dysmorphic disorder. Patients that will never be satisfied irrespective of what you do. And it's better to avoid such patients, okay? So, and sometimes if you feel when you are talking to the patient during the consultation, that you can feel from their body language, they have a question in their head, they are skeptical about what you're saying, it's better not to do a treatment initially. It's better to give them the information, ask them to think about it, and then if they want to avail of your service, come back and book an appointment. And learn to say no. If they want something that you are uncomfortable with, simply say no. Simple example, we do not do, let's say, Russian lips. We don't do over the top treatments. So we say no, simply. So because your treatment is your calling card on the face of that patient. Wherever they go, they will ask, where have you done their treatment? And if you do something outlandish, then that's not good for your image. So at the end of your consultation, always recap going over the patient's expectations. So what are you expecting, let's say, out of this laser or out of the filler? If they tell you, I'm expecting this facelift, say, sorry, I cannot offer that. That is a surgical approach. So always give the patient, let's say what we do, give them a mirror, ask them to identify areas of concern, and assess the face from all angles. Look for shadows over overhead light, and advise patients diplomatically of your assessments and recommendations. Because before performing any procedure, make sure that you've educated the patient, giving them information about the procedure, risks involved and possible complications, outcomes expected, duration of treatment and recovery, and of course, the expenses involved. You don't take the patient into the room and put in 4 or 5 syringes of filler and then present them with a huge bill, you know. So Important also to document, and this is something that is now required by the DHA. You have to have a section in your software where you actually document how you have educated the patient. For example, have you shown them a presentation? Have you given them a brochure? Even if verbally you have told them something, write 2 lines saying that I informed that there is a downtime. I stressed upon the fact that melasma can never be cured. Simple things like that, because that can save you if there is any question of litigation later on. So informing the patient prior to procedure is considered education. Informing the patient after the procedure is an excuse. You cannot tell them later on, if you haven't told them previously, that I told you you will have 5 days of downtime. Yes, but you didn't tell them before. So, and something that we do is we devise a treatment plan for those patients that are open to having, let's say, an annual or treatment plan, or patients that want to correct something, how many treatments they will need, how many sessions of each treatment, and the prices involved. And when they send them this individualized treatment plan, they can then study it and book accordingly. You know, I always tell my people, we don't entertain people coming and saying, I want Botox, I want filler, we're not a shawarma shop, you know. We have to individualize it, look at the patient as a whole, and write down, at least, even if we tell them everything that we think they need done, at least it's documented in our software. And if they are open to it, we can send them this treatment plan. So you have to document all this in the patient's file, and the plan that you make for the patient must be rigorously followed by your staff. I cannot stress the importance of this. So for example, say you tell the patient you will need a laser for your pigmentation. Your staff, once you send if you're not doing the treatment yourself and you send the patient to one of the providers, healthcare providers, the healthcare provider has to look at what your suggestion was initially and adhere to it. They cannot change your suggestion, because then the patient will lose confidence in you, your staff, and the whole clinic. So the healthcare provider must reinforce what you have said, and the admin, the plan must be also followed by the admin, who will book accordingly. We always try to make sure that the first treatment that we offer gives a wow effect, because that wow effect will never be forgotten by the patient. This is an example of a wow effect. This patient was obviously treated with intense pulsed light, which is contraindicated literally for her skin type in the US. And she went along for 2 years looking like this. So 2 weeks after we treated her, she, of course, had a wow effect. And of course, she will never go anywhere else for her treatments. And this is a good strategy, I believe. Patient education, we have PowerPoints for each and every treatment that we have on offer in our clinic with relevant information, and you have to include your own results in the PowerPoint, not some stock images or other people's results, your own results. So for example, this is part of the PowerPoint presentation for fillers. So we tell the patient, you see, in youth, we have the inverted triangle of beauty, whereby the onlooker's attention is captured between the area between the eyes and the mouth. As we grow older, the lower face becomes heavier and the mid-face deflates. So now we have the triangle of age. And then we go on to show them little things like this, which is pertaining to the fat pads under the skin, which gives us our overall shape. So we tell them, you see, number 1, let's say, or number 2, in your case, have deflated, so you need filler in this area. Things like this. So we explain to them what is the reason behind the aging signs in their face. And then we begin to show them our results, and in this case, happen to be a long-term benefit of one of the fillers that we use, okay? And then the treatment. Make sure that the patients have signed all the consents. Cannot stress the importance of this, because if you don't have a signed consent and the patient complains to the DHA, and by the way, they're very happily entertaining the DHA, I mean patient complaints. Anybody can go and complain about anything, and this has become more prevalent nowadays. So you have to have the consent form. If you burnt the patient with the laser, but they've signed the consent form, it's one thing. If you burnt the patient and you don't have the consent form that this can be a consequence of some, or a risk of some laser treatments, then you're in deep trouble. So adhere to the set protocols within the institution and be totally focused during the treatment on the patient and the treatment. Your full attention as a provider must be on the patient and the treatment, okay? Believe me, patients feel it if you are not focused, if you are daydreaming while you're doing the treatment, they feel your energy. And that's very important, that you are totally committed. And be sensitive to the feedback from the patient. If the patient say, I have pain, stop. Check why they have pain. I mean, you should never do a treatment in a rush. We have seen patients coming from other clinics with burns all down their legs, simply because the provider was insensitive to their feedback. They said, oh, it's okay, you need to have pain. Lasers cause pain. No, okay? Very important to give post-op instructions, written instructions that they have to sign, and give them a copy, and keep a copy of what they've signed in their software, and always call patient for regular follow-up and monitoring of their progress. Remember, your work is your best marketing. If you give outstanding results, people will always ask where the patient went. And this is how you will have, and you will grow your word of mouth marketing. And follow up and accountability, very important. Accountability, we are accountable for the results we deliver. So follow up on the patient's status the day after. Maybe it might not be you calling the patient, it might be your admin. And if they are happy, you can always request patient reviews. This will increase your Google reviews, positive reviews. Schedule follow-up appointments to gauge not only the patient satisfaction, but to document with post-op photos. You have pre and post photos, and these must be standardized photography. It can be sophisticated 3D photography, or a simple dark room with a backdrop, with a tripod, not an iPhone photo. This is not medical photography. And you cannot communicate effectively with the patient, the pre and post, if you have an iPhone photo, okay? So, and again, this helps you against possible litigation. So a picture speaks 1,000 words. So this is before and after 3 sessions of one of our treatments. There's no doubt that there is a dramatic improvement. Again, this is before 4 sessions of a fat-reducing treatment, where we have actually even been able to get data as to how many cc's of fat the patient has lost. Not only the before and after, but literally proving to the patient that they have lost a certain amount of fat. So there is no subjective evaluation of this. This is totally objective data. So in conclusion, setting up a practice that consistently gives a positive patient experience at all levels with a team effort, and you have to develop your team and train your team to be able to do that. ensure proper follow-up, and track patient results. We owe it to our patients to prove to them that we've given them results and they have something to show for their expense and their potential discomfort and time that they have spent in our practice, and ensure that the patient, ensuring that this is a positive patient experience will encourage not only loyalty, but positive word of mouth. Thank you.
Thank you so much, Maria, for a very insightful and very thorough overview of every touch point of how to build patient loyalty, which it's hard work. I think there is nothing simple. There is no pain, no gain. And you need to involve each and every single member of staff and making sure the patient journey is impeccable so that they have no other choice than coming back to you because that service cannot be matched. Lots of very interesting takeaways. Thank you so much. Do we have any questions from the audience today from some of the information that was provided? Feel free to unmute yourself or drop the question in the chat box.
I have a question. Thank you, Dr. Maria, for the amazing lecture. So you talked about patients who you suspect they have like body dysmorphic disorder. I wanted to ask you, has it ever happened to you that you referred them to psychiatrists or further help, and how you do it? Because this is a very sensitive matter. And, you know, now with the Snapchat filters and stuff like that, it's, you know, I've seen so many cases, but I don't know how to like discuss it in a way that it doesn't offend them or like,
you know, honestly, we definitely have encountered patients that have body dysmorphic disorder. You can tell from their body language, you can tell from the fact that they expect miracles, you know, and I have never actually sent anyone to a psychiatrist. It's a bit awkward for me to tell them, you know, you need psychiatric help. You get my point. But at the end of the day, I want to protect my organization against people like this because they're a source of trouble. You know, I mean, recently we had a case of one patient who came for melasma, okay? And I was very clear with her. She kept telling me, I want a laser for melasma. I told her, sorry, dear, we are a laser center. We have all the laser technologies you can think of. But melasma is not first-line laser treatment. First line is creams. So I gave her a cream. She was completely clear. She came back full of melasma. I told her, look, what did you do? She says, I went to Georgia and I was in the sun. Did you wear a sunscreen? No. I told her, look, I told you sunscreen, white brim hat, use your creams, which she did not. So what can I do? She keeps insisting, use a laser for melasma. You know, she has some kind of mental fixation about lasers and melasma, and she thinks she knows better than us. You understand what my point?
yes.
So at the end, even though we had at that time, by the first time she came, we didn't have the really effective cream because it was out of stock from the country. By the time she came with a recurrence of her condition, we had the best treatment we have now for melasma, which is our go-to. But I didn't even give it to her. I didn't even sell it to her. I just didn't want her to be in the clinic. You get my point? So at the end of the day, you have to protect yourself, your reputation, and your institution. It's not my duty to send her to a psych. If she doesn't realize that she has a problem, then I think it's better not to entertain patients like that and protect yourself, you know?
Thank you, Dr. Maria. We have another interesting question from Dr. May, who's a pediatric dentist. And she's asking, do you give patients any incentives to refer their friends to you?
No, we don't. Maybe we should, but we don't. You know, honestly, this has been all along. I mean, of course, our loyal patients, they send their whole family, their friends and everything. Very, very rarely will we, for example, let's say we have a new treatment we've instituted in the clinic, we will give that patient a full course complimentary. But we don't give discounts. We don't do offers. I'm sorry, this is just the way we operate, because we don't want to attract a different level of patients. I don't mean level financially, I mean level educationally. Because we know what services we offer. We know we are only using premium products and not products bought from the parallel market or fake products, by the way, which is rampant out there. So the only offers we do is the Is'ad and Fazan. That's it. We don't have any specials, no Christmas, no Thanksgiving, no nothing. Yes, but for the lower patients, the only time we do something is like if we have, like, for example, we had an M-Face treatment. It's a new treatment. It's expensive treatment. So for those patients who've been our loyal patients, not only because they have been loyal patients, we offer them the treatment, not necessarily because they're sending somebody.
Mhm. Thank you. This is always an interesting subject. But we always like to say once a discount, always a discount. So just remember that once you devalue,
True.
it's hard to not devalue in the future.
True.
Dr. Maria, another question, interesting one actually. How did you approach your older patients after a 4 years gap in practice when you reopened the clinic and the market changed in the meantime?
You know how it is. Well, by that time we had Instagram. When I came back, there was already Instagram. So I was on Instagram. And when one patient knew, they would tell their family, their friends, it snowballed. That's it. I never actually personally, my staff did, we had some of the names, because all the staff who came with me here were people who were with me before. I have only one new person. So all the admin were my old people. They could remember one or two of the names. And then once we contacted some of the people, then they told people in their community or people they knew used to come to me. And that's how it happened.
Yeah. So word of mouth still.
Word of mouth, yes. It's all word of mouth.
And you still believe that in today's crowded and noisy city that we live in, that word of mouth still has that space, that patients will still be your ambassador if they're happy.
Yes. I mean, now, of course, we have started a little bit, I mean, some marketing. We have just established the website. We have a little bit of Google ads. Of course, we have Instagram for the clinic. I have Instagram. My doctors have Instagram. But yet, I can say 90% of people coming are, again, word of mouth. How did you hear about us? My friend, my sister, it's like that.
Yeah.
Yeah.
And they're more committed from the beginning when they come from word of mouth because they already built that trust.
That's true. Yes. Yeah. I think especially now, people are beginning to become suspicious and apprehensive about what they see on social media. I'll be honest with you. A lot of them realize that, first of all, I am sorry to say, totally, I have been from day one anti-blogger. Anti-influencer, I think the day that a blogger or influencer is going to give medical advice in my place, there's no need for me. You know, it's demeaning for me to have an influencer talk about my expertise or the expertise of my clinic. This is a clinic. This is not a chocolate shop. So for me, this is it's a no-no. It's a no-no. Social media, yes, you have to be on social media, definitely. But you, as a practitioner, showcasing your work, showcasing your advice with honest results, not fake results, sorry to say.
Yeah. So if you had today still, as you said, you're doing Google Ads a little bit, website and Instagram, like which one do you think for you is the most essential today outside of the clinic? Which form of marketing do you believe in the most, let's say?
I have it from you, Servan. That website and SEO, which we plan now to work on much more, are the most effective. I mean, as far as I don't know much about marketing, I'll be honest with you.
Another question I have, thank you, Maria, is obviously your Instagram is very authentic, I would say, and it's full of authentic posts with real results and scientific. Does
Yeah.
that yield inquiries from new potential patients that actually convert into walk-in patients, or not so much? Do you feel like it's more entertaining and feeding information to your existing patients and followers?
I must say, I have had a few who have been searching for specific treatment that have found me through Instagram.
Mhm.
And I mean, I only talk about treatments on Instagram that I really believe in.
Mhm.
I never talk about a product, commercial product that I have no experience in or I don't believe in. So I have had, but in general, no, I don't feel that Instagram really brings in patients.
Yeah, still not your
No.
main source, definitely outside of the clinic. Okay, is there any other question from the audience? I have maybe just one last.
Yes.
Yes.
Hi, Dr. Maria. Thank you so much for the lovely presentation.
Thank you.
Just asking that have you ever tried to tie up referrals from your colleague doctors, like of different specialities, so that you can refer patients back to them and they refer patients to you authentically? But I mean, like, you
Yeah,
don't have to pay them anything. They just know that if this is the right patient for you, they would send it.
yes,
And how
actually,
did you do it?
I didn't. It just so happened that a lot of our patients are doctors because we have a training arm as well. So I train for the A4M. So I train a lot of doctors. So they send patients. First of all, I see a lot of complications. Okay, this is one thing. But apart from that, we have gynecologists, plastic surgeons that send us patients. They are our patients and they send us patients. But I haven't really actually made an effort, to elicit their support. But they happen to be my patients and they send me patients. That's it. But
You're very lucky.
I don't think these tie-ups really work, to be honest. I mean, there are one or two who send me patients for scars, let's say, surgeons, etc. Because again, we have the technology.
And Dr. Maria, perhaps another what if question. Do you think that if you had not opened your clinics, let's say back in 2002, and built that reputation in the market, which you did, but you had opened fresh with the current, let's say, outstanding clinical process that you have and patient journey, and you had started from scratch in 2000, I think, what was it, 18 or 22? Like, where do you think you would be, and what would you do?
I would dread to think. Then for sure, I think people who start, they need these bloggers and influencers and whatever they can throw out there. I'm sure it's very difficult to start from zero, not having any, established any reputation previously. I dread to think what it would have been like. I don't think I could have survived. I don't think so. It's crazy. I really don't know what these people are doing, honestly. But another thing is I never look at what other people are doing. This is another thing. I have my head down, do the best I can, take care of my patients, and that's it.
Yeah.
But for people starting fresh, it must be very difficult.
Yes.
They need a lot of marketing, I'm sure.
So you train a lot of freshers and doctors subspecializing into aesthetics, coming from other fields. And what advice would you give them to those thinking to join or embarking in order to succeed?
Honestly, from what I'm hearing, I'll be honest with you, I just advise, because many of them join existing clinics, many of them. So they have to vet the clinics the same way the clinics vet them.
Absolutely.
Mm.
Yeah, we
Yeah.
obviously make sure that the employee interviews the employer, not the other way around.
Yeah.
Thank you. And one maybe closing question about actually the team and the staff surrounding you, because of course they are your ambassadors and the magic cannot happen without them. And as per the quote of Wendy Lewis, I love it, employ people who actually are nice and not just act nice. I know that you have always had a very tight, thorough screening, interviewing process in the clinic. And what is your advice when it comes to maybe doctors looking to hire someone in the clinic, and how do you find those hidden gems?
I'll be honest with you.
And
I'm
suss
not,
out personality if it's going to be the right person for you.
I'm very gullible as a person. So the person who does the interviewing is my husband.
He's very thorough.
He's very thorough. Yeah, he's really thorough. He's the one. But whoever doesn't fit in soon enough gets filtered out. But one thing I'm very, very strict on is positive energy in the clinic. I will not entertain any bickering, sorry, any backstabbing, none of that. That is a no-no. The dynamic has to be very, very positive among the people in the clinic. If there is one bad apple, they cannot survive. Because it filters through, Patients sense it, the whole environment gets poisoned. I think having a good, positive working environment is very important, and this centers around the people.
Mm-hmm. Yeah.
Yeah.
Yeah, patients cannot ignore positive energy. They say it's contagious.
Yeah, it's true. Yeah.
Thank you so much. It's been very inspiring sessions, which actually is very down to earth and reminds us the importance of excellent clinical work and ethics in the clinic. So thank you, Maria, always for bringing positive energy to us.
Thank you.
Thank you to all
Bye.
the participants who joined this evening, and have a lovely rest of the day. Take care, everybody.
Bye, everyone. Bye.
Thank you. Bye-bye.
Yalla.
Yalla. Thank you, Maria. Bye-bye.